Vancouver, British Columbia, is Canada's third largest city and home to over 2 million people. From the standard public healthcare facilities to the many alternative medical options, Vancouver is a diverse community that continues to offer new and exciting medical choices for patients. One company that offers alternative medical solutions is NeuroKinetics Health Services,
Good afternoon, NeuroKinetics.
a company and medical clinic based in Vancouver since 1997. Dr. Philippe Souvestre, the founder of the company, is a medical doctor specializing in neurophysiology from France. One child who Dr. Souvestre began treating in October 2003 is Stephanie Currie. Stephanie was diagnosed with epilepsy when she was only 14 months old, after having complications from receiving her routine vaccine immunization shots. After over half a decade of trying various treatments and heavy medication, Stephanie's family turned to NeuroKinetics in the hopes of finding some answers to their daughter's condition. By combining their experience of neuroscience, aerospace, and traditional Chinese medicine, NeuroKinetics has gained international acclaim.
The whole approach is based on first understand, second correct, and third monitor and ensure stability of recovery. Understanding is a key point on the sense we specialize in sensory motor control and related cognition. It means we cover all the physical and mental activities or abilities that healthy human being is expected to provide in daily life.
7 years ago, when Stephanie's mother Maria gave birth to Stephanie and her twin brother Brandon, there were no indications that their daughter would suffer from epilepsy. Following numerous tests, including muscle and skin biopsies, MRI and CT scans, doctors were unable to determine the cause of Stephanie's seizures.
Well, basically, after having undergone all those tests and they couldn't come up with any specific reason what was causing these seizures, they then put us on a combination of anti-epileptic drugs, which was all basically they could do. These drugs controlled the seizures to a certain point, but never really eliminated them.
Having to find the financial means to afford Stephanie's special care requirements, such as her playpen and safety helmet, has been a challenge. With the Curries' lives changing dramatically, they felt it was time to begin treatment at NeuroKinetics.
Well, Dr. Souvestre procedures are totally non-invasive, which means that they require no drugs or no surgery at all. So that was the number one thing that we noticed with him, is that he, with the probes and the nervous system treatments, drugs were not any part of his treatment.
Both Lauren and Maria saw an obvious change in their daughter, even after the very first treatment at NeuroKinetics.
She responded very well. I think she kind of connected a bond with Dr. Souvestre. I think she likes him and she feels secure, and she doesn't fight it when he's actually doing the treatments.
Pleased with the results, the Curries continued Stephanie's intense treatment schedule, seeing Dr. Souvestre 3 days a week for 2.5 to 3 hours a day.
I think I owe the abilities to identify what I could do and what I have done successfully with Stephanie, as with other patients, to my training in neuroscience, aerospace medicine, and other specialties. And my understanding of why other doctors were unable to identify and provide the same type of services. I think that ties with their lack of training in some critical areas in respect to epilepsy treatment.
Within North America, the traditional public healthcare system is often looked upon as the only option available to patients for any form of treatment. This, in turn, leaves various forms of alternative medical approaches to be overlooked. According to Dr. Souvestre, it is important that clinics such as NeuroKinetics and other alternative forms of medicine be more recognized as complementary to the BC medical system.
What I would like to see happen in respect to improving the healthcare system is definitely setting an open communication and dialogue between physicians, and changing the way things or values are conveyed within the medical community.
One non-profit organization that has become a strong supporter of the work done at NeuroKinetics is the Better Day Society.
One of the missions of our society is to try and help families that really don't have the resources to come to a clinic like this, even though I think it's relatively inexpensive based on the results. But there are a lot of families that just can't afford to come here. And the Currie family was one example, and we're glad to help in that case.
Okay, it was good.
Thanks to the financial assistance of the Better Day Society, Stephanie has been able to continue her treatments at NeuroKinetics. She has made immense improvements that previously were deemed not possible by other medical professionals. Stephanie now is seizure-free, except on occasions when she has fever. Remarkably, Stephanie also no longer has to take the anti-epileptic medication. She's now completely drug-free.
Well, we have a better outlook now. We feel more at ease. We just hope that she'll, continually develop, and hopefully one day she'll be able to talk to us.
We envision the future at some point in time. We hope that she will be able to walk and talk and lead a normal life and be able to play with her brother.
Stephanie's journey with us has been a very interesting experience, as always. It took 4 months to have her seizure-free. It took 7.5 months to have her drug-free. She progressed quite significantly in the motor area, sensory area, cognitive area, and became much more proactive, communicative, interactive, and initiating some actions which she wouldn't have ever done before. She's really on her way to become a beautiful young lady.
Stephanie Currie is one of many patients who, thanks to the help of NeuroKinetics, has been given another option and opportunity to try and treat her illness. Providing hope and inspiration for patients such as Stephanie Currie continues to motivate Dr. Souvestre and his team. It is hoped that over time the medical community will recognize alternative medical practices such as NeuroKinetics and include it in the healthcare system. Of the estimated 40 million people in the world with epilepsy, 32 million have no access to treatment at all, either because services are non-existent or because epilepsy is not viewed as a medical problem or a treatable brain disorder. Stephanie Currie is only one of these cases. With the help of NeuroKinetics, there are now other options available to people who suffer from this disorder.